Everybody. Thank you, Mariana. Thank you, Nancy, for joining our week 6 live session. So today's agenda is pretty light and simple, really. And I see right off the bat an error, typo here. I apologize for that. So we're going to do an overview of HIM functions in light of the course project. So it's going to be specific to the course project. And then from there, I'll address different parts of the course project. And then, of course, answer any questions as we go and at the end. All right. So when we talk about the HIM functions, you're thinking of coding and release of information, record processing, things of that nature, right? So in this course project, you do have spreadsheets on and reports on different things. Particularly, you don't have anything, in coding and other things, but it's release of information and record completion, right? Okay, so those are the two that we're going to focus on. Then you also have a spreadsheet with meaningful use, and you have some details there. You have core measures and then incident reports. So this is the PowerPoint, really. There is just these two slides. So what I'm going to do is I just wanted to show you, first of all, the plan. And then I'm going to go straight to sharing my screen and working with the Excel spreadsheet that you are going to work with. So the explanation of these functions will happen from there. Okay? So I'm going to stop sharing this PowerPoint. I'm going to share my screen. And then you tell me when you see the Excel spreadsheet. Do you see the Excel spreadsheet? Okay. And I apologize. I just need to close my home phone. Perfect. Okay, so the first thing that you want to do is familiarize yourself, with all the different sheets that you have here, and then scroll all the way to the end. Okay, so that's where you have the incident reports, core measures, and meaningful use. And then you have the standards that are given and the rubric. Okay, so we'll start with record release of information. Release of information is one of the traditional functions in the HIM department. What does it require? It requires that you analyze, you inspect a request that has arrived for release of information. And then according to HIPAA, you have to log that in. What that means, you have to document that you received a request for release of information. And then you inspect if all the elements of a valid request are there. And if they're there, then you disclose the information. According to HIPAA, the guidelines for disclosing information are 30 days. So if you have the record stored on site, you have 30 days to respond to release that information, of course, when the request is complete. When the request is not complete, then you would have to communicate with the requester and let them know that this request is missing 1, 2, 3 things. And usually what happens is that you send them a form, and many facilities even highlight the areas that the requester has to fill, and then of course sign. Okay, and then you also have to have the authorization for release of information from the patient. So all of that is logged in. It's like it's done on a daily basis. And then as the requests are complete and the information is available, then people who work in release of information will fill them and release them. Okay, so I have Amy who has joined, just making sure that I'm not missing anything. Thank you, Amy, for joining. All right, so this is what you have here. You have a report. Of course, it's abbreviated. You don't have only 20 requests in a quarter, but just for the purpose of practicing and working with this type of function, we have just excerpted a few requests. So if you are logging the information, let's say in a system, either 3M or maybe SoftMed or whatever people are using out there, there's different systems that they use. Basically, they put in the date when it was received, who requested it, And then once it is disclosed, the date when it was disclosed, who disclosed it. Sometimes just by virtue of logging in, you will see the staff ID, okay, who actually worked on that record. So this is an example of a report that you would get. So your supervisor, let's say you're the supervisor and you're running a report and say, okay, let me see how we did this quarter. So we received 20 requests and they came from these clients. They were received on these different dates. And actually, this is just a month. Actually, it's just month of January. Okay. And then you also look at why, what was the reason for the disclosure. You look at what was disclosed particularly, and also the date of disclosure, records, where the records were located, and the staff ID. So I mentioned earlier, this is key. This is a standard that you have to comply with. If the record is stored on site, you have 30 days. However, if the records are stored off site, sometimes, let's say it's an old record, patient hasn't been seen there for 2 years, it's considered inactive for the moment, but you still have to keep the record. And if the facility does not have enough space, they'll ship the records off-site. They have contracts with off-site storage companies. So that's what the yeses mean here. So this particular record was not on-site. It was off-site. This other one here was off-site. This other one, okay? So it means that according to HIPAA, to accommodate for the additional work and the additional time needed to get the record, they have 60 days in these cases to respond to the release of requests, to the release of information requests. So this is exactly what you have here in this spreadsheet where you have standards. It says release of information for records stored 30 days on site. Okay, so if you click here, it says actually on site, and you can expand it a little bit. Or off site is 60 days. Now, how do you know whether you are in compliance or not? Because that's what you want to know. That's your goal. And that's what was described in that recording that I shared. Basically, if you know when it was received and you know when it was disclosed, it's just the difference between these two dates. So if the request was received on January 1st and disclosed on the 21st, how long did it take to actually complete this request? To disclose the information? From the 1st to the 21st. This is an easy one, and you can do mental math, right? It's 20 days. Perfect. Yes. Now, in order to automate this, you can just insert those formulas. So how did we do this type of calculation? We used the date when it was disclosed, and then we subtracted the date when it was received, right? So rather than doing this by hand and counting your fingers, all you do really is just do the formula for one of these, and then you just drag it all the way down, and that's it. Okay, so now you have the dates, and you can see which one took longer than 30 days. Oh, this one. Well, was it stored off-site? No. Actually, this should have been done in 30 days, so this is out of compliance. Let's look at this one. It's 53 days. Well, how long did we have for this one? This was stored off-site, so the standard was 60 days. So this one is okay. All right. So this is the process of analysis that goes on. You're just going through these and analyzing whether these were completed on time or not. And then let's say you have 20 altogether. If let's say 2 of these were not released on time, so what is your compliance rate? Your compliance rate would be what? 18. So if 2 are not released on time, but the rest of them are, then the 18 out of 20, that's your compliance rate. Okay? So that's the rule of thumb. It's actual versus potential. So I'm going to write it here just, for the sake of remembering. Actual versus potential. That's the general formula that you need to use for all the rates. Okay? What does actual versus potential mean? It means how many requests were released on time actually. And that you can only do after you analyze this information and you compare it to your standard. Well, how many should have been released on time? That's the potential. The potential is all of these, all 20, should have been released on time. So from there, you determine the rate of compliance for release of information. Does that make sense? I don't want to write everything down because you have it on your video. I just wanted to add more to the background here. All right, very good. So then you move into the other areas. You have physician orders, you have history and physical, discharge summary, op reports. All right? So what are the standards for these? Go right into the standard area. For the signing physician's orders, they have 24 hours. So from the time the order was given to the time that, when it was signed. So this one here actually is very easy to do because all you have to do is go here to the physician orders and see when it was ordered, when it was signed. If it was within 1 day, that's 24 hours. And again, you can do the same calculation with those dates subtractions. Now, I see sometimes that students, and I'm speaking from experience of teaching it in the prior sessions, they get confused with the subtraction and they get lost in the formula. It's really not, this one is not about the formulas as much as about using your critical thinking. Sometimes they end up with a minus, or they don't know what to say about a zero. So if I put the equal sign here and I have the date signed minus the date of order, right? It's 0. What is 0? It means that it was done within 1 day. That's all. So as long as this number here is not 2 or greater, you're fine. And it cannot be less than 1. Remember, it cannot be a negative number, because what would that mean? If it's a negative number, it would mean that it was signed before it was ordered, which does not make sense, right? So as you're using your formula functions, look at the numbers you get and look at it critically and say, okay, why did I come up with a negative number? You shouldn't. Again, because the date signed comes after the date ordered, or it's the same day. Does it make sense? Okay, and this is pretty simple here because you're seeing this person was in compliance with everything was signed, within that day or the next day, which is still 1 day. And that's the standard. It means that Dr. Jones was doing really well. Okay, but you're going to repeat this for all of the others and figure out, again, what the compliance rate is for the others. For example, what is the compliance rate for these here, for this one here, for Dr. Jones? What is it? I'm going to make this yellow. What did you say? Just quick mental math. So the compliance rate, again, refers to how many of these orders were signed on time versus how many should have been signed on time. Perfect. Yes, Mariana, it's 100%. It's 7 out of 7. Exactly. All right. So again, just look at it. Like if you look at this data here for Dr. Patricus, the date of order was January 18th. He signed them on January 21st. Just quickly, just looking at it, what would you say? How was he doing? How was this doctor doing? Yes, nothing was signed. It took 3 days for each of these, all right? So again, look at the data carefully. Use the formula when you can because it just makes it easy and quick to do the calculations. However, if you put the formula wrong, like if you do date of order minus date of signature, you're going to get the wrong numbers. Okay, and that's going to mess up your compliance rate. And in that case, again, a warning, if you get negative numbers, look at your formula again. You should not be getting any negative numbers. If you do, you did it wrong, and then go back to your manual completion and say, okay, look at the dates and was this on time? Yes. Was this on time? Yes. No, no, yes, yes. And then you count the yeses, you count the total number of records, and then you figure out the compliance rate. It's still actual versus potential. So you think you understand the physician order piece? Good. So another piece of record analysis, because now you work in record analysis, okay? And you're going through the different pieces of completion. So when the Joint Commission comes in, they're going to look at, okay, so did you actually have all the history and physical documents? Did the physician complete them within 24 hours of admission? They are not going to wait for you to go from record to do that. They will ask for a report. So you run a report and they say, give me from this date to that date. And then they might say, I don't want to look at individual patients. I just want to look at your compliance rate. Okay, so you go to the record, to the reporting function, you run the report, and then you can quickly use that Excel function, because most of the systems now provide opportunities for you to export a report into Excel, and that's why we ask for Excel reports here, just that you get some familiarity with it. So basically, the same thing would happen here. How would you calculate how long it took for a physician to complete a history and physical, to dictate it? When they dictated it, here's something else that you probably are aware of, but what does dictation mean? They actually picked up the phone and they dictated the findings from the history and physical. It means that it was done. They did it. Now, from that point is not totally complete because it's not signed, but it was done. The reason it's not signed is because it needs to be transcribed first. So as a process, as a function, patient comes in, let's say this patient here with number 789321, this patient came in on January 4th, and the physician, you see date dictated, the physician actually did that history and physical on the 4th, which is within 24 hours, right? Look at the other one, Huffman. Dr. Huffman admitted another patient to the hospital on the 4th of January, and then did the history and physical the next day. And this is, again, good. It's 24 hours. It's acceptable. Okay? Look at this other one. Let's see. Excuse me. Look at this one. For patient 335588. Dr. Johns admitted this patient on the 28th, but the history and physical was dictated on the 31st. Now, we can't know that the doctor actually did the history and physical before that date until they actually write it down. That's the date we're going to consider. So if it wasn't documented, it wasn't done. If this is the day it was documented, right, then that's what the Joint Commission is going to look for. That's any auditing services, that's any other CMS or whoever is going to look for this information. They are not going to assume that, oh, the doctor actually did it on the 28th or the 29th. He just didn't have time to dictate it. No, if it wasn't on the chart, either dictated, because they can see whether it was dictated. It's actually, there is a system for that, and you can log in and you can see that it was done. Okay? They're not going to know. If it's not written, typed, or dictated, it's not done. So was this one in compliance? No. Right. Okay. So again, you can do the formula very easy here and say days to dictation, and say equals to, then you take the date of dictation minus the date of admission, and then you can just drag it down and figure out, all the other days, and then you can see which ones fall out. Anything that's greater than 1 is not good. All right, so what's left is compliant. What's not there, it's not compliant. And then the other requirement, let's go back here. So you know how to do that now, right? So you're also going to check the rubric. So did we do So you're just going to go through this. Did I calculate how many days it took the releases of information? Yep, I did that. Did I calculate how many days it took to do the signatures for physician's orders? Good. Did I do the dictation for history and physical? Yes, you get the points 5. That's how I'm going to grade them. I'm just going to walk through your spreadsheets, and then I'm just going to mark, yes, this was done, this was done, this was done, right? This is how I'm going to do it. And then for the HP transcription, okay, so we didn't do this yet. So you go back and say, okay, what's the standard for that? What does it mean? Transcribing history and physical. All right, it says that the rule or the policy is that the transcription service has to dictate it within the day. Like when the transcription company, or if it's in-house, the transcription is in-house, get the pool of all the dictated reports, they assign priorities to them. Reports could be anywhere from a progress note, some physicians even dictate those, to histories and physicals, to operative reports, to discharge summaries. It could be maybe interpretations of an x-ray. There's different things that are being transcribed, okay? Now, when they get an HMP, history and physical, they are asked to do it in 24 hours because this is a higher priority, let's say, than a discharge summary. That's the way the policy is. And anyway, for this case, that's what you're going to assume. So what tells me, how can I calculate how long it took for the transcription service to actually complete their job? What information do you need? You need the date when it was transcribed, of course, right? And then what other date? Could they have transcribed it before it was dictated? No. So days to transcription is what? Is equal to the date it was transcribed minus the date it was dictated. It's not the date of admission, because the patient could have been admitted, like in this case here, patient was admitted on the 28th, and then here, if you took this in consideration, then you would end up with a really, large number here. But the truth is, the history and physical was done on the 31st. The transcriptionist dictated it right away, as soon as they got it. Okay? So as far as transcription goes for this one, is fine. However, when it was done, when it was dictated by the physician, that wasn't correct. Okay? You're going to look for the other one that falls out here. Okay, so we're back here. So you did that, and then you go into the discharge summary, dictation, and signature. This is completely similar to what we just did, except for now we don't consider the date of admission, we consider the date of discharge. A physician cannot dictate a discharge summary before the patient is discharged. It has to be done when the patient is discharged or after. Okay, so these are the two dates you're going to work with when it comes to calculating the number of days it took to dictate a discharge summary. Okay? How about the transcription? How many days it took? I'm not going to write all the formulas for you here, but in general now. So how would you calculate how many days it took to transcribe a discharge summary? And you can actually go here. Dictating a discharge summary is 30, it should be done 30 days from the discharge date. That's the guideline, all right? So what do you have? What do you have here? Date dictated minus date discharged. You do that calculation, it's about 20-some days, okay? So it's still under 30, that's good. Is it still making sense for everybody, or I'm trying not to type everything because then you'll have all the answers. So dictating. Okay, so dictation, very good. We'll explain dictation. Dictation is the process of speaking your findings. So physicians, rather than typing, often they don't type because they feel that they're too busy and they don't want to handwrite either. So they'll pick up the phone and they'll dictate. So they say, for example, patient was discharged today at 10 a.m. the final diagnosis was this and that. During the hospital stay, patient had this procedure done, and they'll continue the details. Patient was advised to follow up with primary care physician, and if they develop any signs like this and this, they should come back to the hospital. Patient was put on Prozac, or that's the summary. And they do this on the phone. That's called dictation. Does that make sense? Do you understand what dictation is? So this is recorded and it's saved. It's just the phone system. It's a recording. Okay? So it's a recording system and it's saved. It's stored. It's one of the systems, many systems that the facility has. And then the transcriptionist service will take these. Then once the dictation is done, they'll see a report coming up in their queue. They have this queue of the list of reports that are being dictated. There might be maybe 100 physicians in the facility. And then they'll look, okay, which one was dictated, when it was dictated, and what type of report was it. So then they go through that queue and they prioritize. If it was a history and physical, they know per policy they have to do it as quickly as possible within 24 hours. So then they'll put their speakers or headphones on, and then they'll listen to what the doctor is saying. As they listen to it, then they'll type it. And then when they complete that transcription process, then they save, and now the physician has a document that's ready to be signed. So that's the process. I used to do this actually as part of my job at Fox Chase Cancer Center. So typically that's what happens. Now I would log into the system and see, okay, not the transcription piece, I would see whether the record was complete. So I would see, okay, I have a list of 35 patients that are discharged today. Let me see if the records are complete. Was the history and physical done? And I would check if there was a typed report. Okay, it is. That's great. If there was no typed report, then I would go into the dictation system and see, was it at least dictated? And then if I saw that it was dictated and it was dictated on time in 24 hours, then I would mark that and that was fine. And then transcriptionists though would be alerted and say they didn't really do it quick enough. Okay, and then I would see if they actually did the report and send it to the physician, but the physician didn't sign it. That's another problem you have to deal with. So did the physician sign this in 30 days or not? Is it making sense as far as the flow of information goes? So these are part of the daily functions in an HIM department. Okay, and that's why this project is kind of important, because you might have to deal with it at some point. Okay, so now that we know the dictation happens after the patient is discharged, and then the transcription happens, and then hopefully the physician will sign it within 30 days. Okay, so now go back to the standards. And then here, to sign the discharge summary, a physician has 30 days from the date of discharge. So how do you calculate this? Date signed, date of discharge, right? These are the two dates you're going to look at. You're going to look at this one and this one. Okay, so of course, all the way from for all 20 records, but just as an example, as an illustration. So was this one, just quickly here, visually, was this one signed on time? It was, a patient was discharged on January 8th, and the chart was signed, the discharge summary was signed on February 10th. I mean, you can do the formula, of course, date signed minus date of discharge, right? But just quickly, was this done on time or not? No, it actually took more. See, on time would have been February 7th, because January has 31 days, right? So that's when it would have been on time. So are you getting this part of the project now? Yes, that's correct, Amy. So we know how to calculate this. We're good? All right. So all you're going to do is really go back and forth here, or you can write these down so you can have them in front of you. And then also try to not miss anything here. So did I do dictation calculations? Did I do the operative report signature? Again, you're going to go to the operative report. Same thing, when it was signed and when actually the operation, when the patient was discharged. So you have all the standards here for the operative report 30 days from the discharge date. So you go here, when is the date of signature? When was the date of discharge? And then you figure out how long it took to sign it. For the dictation is 24 hours, just like the history and physical that we just completed. So for that one, you're going to look at the dictation date, make it a different color, and the date of surgery. So a different set of dates. And you're just going to show these calculations here, and you're going to make sure that you label it well, so I know days it took to sign it or days it took to dictate, things like that. Okay, so we're back at the rubric. So we're done with all the calculations. Now that you have identified how many of those were done on time and how many were not, right, you're going to figure out the standard. The standards really are given for you. All you have to do is just note them. You would have to note them. Let's say you can add a column here and say standard, and then say standard to signature, to signing, and let's say 30, 30, 30, because it's 30 for all of them. Okay, that's how you can indicate it. Or you can just write it. You don't want to do it like that. You can write it here. Discharge reports is 30 days. And then you just if you wanna highlight it or make it red or whatever, so I know you added that information. That's how you tell me that you were able to find the standard. So, and all it takes is just matching them with they are given for you. They're all here. You just have to break them apart and put them where they belong. Okay? And you get the 5 points for that. Then you go to meaningful use. All right, so for meaningful use now, there is a different document. And this is in doc sharing. And I have it here saved. Okay? So this is the form that hospitals use to report meaningful use data. Meaningful use data, do you know what meaningful use is? After the HITECH Act was passed, basically the government allocated a large number of dollars to healthcare organizations such as hospitals and physicians' office for them to implement electronic health records or other information systems. The caveat was, if you are going to take advantage of this stimulus money, you need to make that system work. So how do we know that? You have to provide reports to us. So the first one, for example, is the facility using a computerized provider order entry system for medication orders? And then that means that they are directly entered by the licensed healthcare professional in the medical record as per state guidelines or other guidelines. So that's what that objective is. And the measure says more than 30% of all unique patients with at least one medication on their list should be entered through this system. Okay, so that's what they're expecting. So what does that mean? It means that you're going to look at your spreadsheet, go to the meaningful use, and see how is our hospital doing. It says here that according to what the hospital measured, 50% of the percentage of patients that had at least one medication order entered through the CPOE is 50. Is this good, bad? What's your reaction on that? What is your reaction on this? So you know the expectation is 30%, more than 30%. Okay? How is our facility doing? They're at 50. In your opinion, Are they complying with meaningful use expectations? All right, very good. Okay, they are above 30. Excellent. So then you look at the next one, okay? And you go back here and see this has to do with implementing drug-drug and drug allergy interactions. Do they have, so you would think that, if they have a computerized physician order entry, it should have that function to check if there is a drug-drug or drug allergy interaction, right? That would be the expectation, correct? What is the hospital doing? It says that they have not enabled this functionality. It's a no. Okay? So now I'll let you think about that. What do you think in terms of compliance? So for this one, we said it was a yes. Compliant? Was it compliant? And it was a yes. You can figure out about this one and this last one. Okay? So the third one says, are they maintaining an up-to-date problem list of current and active diagnosis? And the expectation is more than 80% should be done. It should be done for more than 80%. Where is the hospital? The hospital is at 50%. Again, I'll let you do the math here. I mean, not real math, but just you're thinking whether they are compliant or not. So then, once you have the three elements, if you have 1 out of 3, then they are 33% compliant, right? If you have 2 out of 3, then you're 66 compliant. And if it's 3 out of 3, is 100%. Does that make sense for meaningful use? Okay, so you understand the concept of it. And then in real life, you see the list is pretty huge. Facilities report more than that. This is just to give you a glimpse of what you may be faced with, out there. In fact, the government often just tells them, okay, give me the numerator and the denominator. So they're not even asking them to do the calculations and say, we'll do the calculations. Just tell me the number of patients, let's say, that had at least one entry, and then all of your patients, number of total patients, and then they'll do that. But in this case, you do have the calculations ready for you. All you have to do is find the matching pieces here and then compare and do the analysis. And then you go back here, you look at the rubric. So now I've done the standard, I know the standard, and I've put it here. Okay, you're going to type the standard, and you can add, you can have standard here, or you can do the standard before the compliance and so on. So just tell me that you know what the standard is. Okay, and then at the end you can say compliance rate is, and then whatever you end up finding. So go back to your rubric and you check, did I calculate the compliance rate for release of information? Okay, I did. Did I do the compliance rate for physician orders? Yes. Did I do it for the history and physical, for the discharge summary, for the operative reports, for meaningful use? And you can get all the points. So I am hoping that I walked you through this step by step, and I can't put the formulas for everything because they're similar, and you do need to do some of the work here because then it will be just, at that point you have all of it. Okay? So do you think you're in the right path? Do you understand, how this course project works, at least for this portion of it? Excellent. And does it make sense in lieu of all the activities that take place? Because again, it's not just, oh, let me do an Excel activity. It's not that. The point is to understand the flow of functions and every activity that happens in the HIM department. So this is part of that. You look into the records, you run reports, and then you have to use that, either for a meeting, or maybe you send your information to your boss, as you will do in week 7 when you write the memo. So I'll give you a preview here. In week 7, you also have a video, another video that I've recorded for you. Hopefully that will help. But now you have a bunch of information already. You're going to save this, and you submit it as your first deliverable, but then you hold on to it because you're going to need these findings, these compliance rates, you're going to need to use for your memo in week 7. In addition, you're going to look at core measures. Core measures are another set of reports. So basically, this is clinical information, and there are certain diseases that the facility looks into and Medicare, Medicaid looks into. For this one, we have chosen heart care, heart failure, and heart attack. There is also pneumonia. There are surgical infection prophylaxis. There is stroke. There is a bunch of other conditions that we collect data on. And this is reported and it's made available to the public. By the way, this is taken from a website. It's straight from a government website. So what you have here is the data that has been reported by General Hospital. So for this particular one, it says average number of minutes before outpatients with chest pain or possible heart attack who needed specialized care were transferred to another hospital. So it means how long did it take for this type of patient to be transferred to another hospital. And basically, they would transfer if they can't provide the care themselves, all right? So for this, for our hospital, it took about 57 minutes. The national average is 59, and there is no minimum expected. If you look down, let's say outpatients with chest pain or possible heart attack who got aspirin within 24 hours of arrival. So the expectation is once they're there at the facility and they're complaining of chest pain and they're evaluated and there is probably suspicion for heart attack, they should be giving aspirin right away to the patient. Is this facility doing that? Yes, at 95% of the time. How about the overall nation? The national average is a little higher, 96. Now, the minimum expected is 80, so they're okay, but they could be doing better. Okay, so this is the type of analysis and the critical thinking that you can do, again, for this. You don't have to write anything for this in your week 6 deliverable, but you have to analyze it and include findings from this in your memo. And then you can look at the rest of that, the other piece here. Let's say heart failure patient given an ACE inhibitor or ARB, and these are medications, types of medications, right? If you remember from your pharmacology class. And they're given for left ventricular systolic dysfunction. So is the hospital doing that for patients who have heart failure? Well, yeah, they're doing it at 95% of the cases. What's the national average is 97. So what's the minimum? 80%. Okay, so in your analysis, you could write something such, the hospital is doing okay in terms of meeting the minimum expectations. However, in order to be up to par with other hospitals and increase the quality of care for heart failure patients, they need to improve on this particular one. Okay? Now, did they do an evaluation of the left systolic function? Yes, they did all the time. So this one is excellent. All right? This one is really good. And this one is good too. So you get the picture here, right? Is this making sense of how you're going to look at this data and not just, oh, this is just an Excel spreadsheet? You understand this? Okay. All right. So then once you analyze it, and you can write in a notebook or a piece of paper and say, okay, which ones am I going to highlight from this table here? Which ones should I actually include in my memo? And you look at some of the things that are positive and some of the things that are not so positive. Because you will have two sections. You have the section, the paragraph with positive findings. Yes, for week 7, I'm sorry, yes. And then you have another paragraph for negative findings, right? So you make that memo complete. You have things from release of information. You have things from the record completion. You have meaningful use. You have core measures, right? So you have a lot of things to talk about. Then the last piece I'm going to touch on is incident reports. All you have here is just a list of what type of incident was reported and how many of each. So you can do a quick visual and say, okay, which one do you it's probably more problematic? Oh, false, a lot of false, that's probably, and if I can combine them both, that's pretty not good. Now I can look at medication errors and allergic reactions, and that probably is not good either, especially if you look at both numbers combined, because what do they have in common? What they have in common is the fact that the medications were not given as they should be given, because either there was an allergic reaction or it was an error. Now, what could prevent that from happening? So you definitely pull that as a negative finding, but then in your last paragraph of your memo, you have to provide suggestions, recommendations for improvement, right? Look at meaningful use. Look at this one here. If they had this enabled, I mean, do you think this has any connection to this? Look at the data. Okay, so I'll let you dig more into it. So you wanna make sure that you look at all of these pieces for your memo and just pull what do you think is more important to be discussed, either positive or negative. And then for all the negative ones, you have to come up with suggestions, opportunities for improvement. And then make sure you use either, like for this one, for the incident reports, you can do a quick bar chart just to show quickly, what type of incidents are happening, or include a table. That's acceptable too, because there's not too many columns. It's pretty simple. The point is, you don't want to give all of these spreadsheet. Your boss does not want to look at all of this. They want a summary. They want some details, they want concise, precise information, and they want the full picture. That's what you're expected to do in that memo. It's not a paper that you have to write a lot of things, but you have to select your information carefully from all of these areas and then show this is where we are. For the month of January, this is what has happened here. We were okay with this, and this. 1, 2, 3. Now, there were areas that we did not do well, we were not compliant with, and that was particularly 1, 2, 3. Now, last paragraph will be, how do we address those? And then you go back to your critical thinking, to your performance improvement tools box, the toolbox, and then if you have to show anything to show data, to present data, you can use a simple table or just a simple graph, something like that. And you'll be good to go. It shouldn't be that hard. Okay? So that's what I had prepared really for this. I'm hoping this was more informative in terms, it's more than the recording, and then it shows you the background behind this project and the role of these functions in the HIM department. And then hopefully you will be able to look at the big picture here and pull particular information from each area and organize it nicely. Are there any questions? Okay. You think you'll be okay for week 6 deliverable? That's the first one. Excellent. So, like I said, refer to the rubric, look at those formulas. Don't accept any negative. If you find anything negative, you did it wrong, go back and look at it. What makes sense? Again, if something was done on the 1st and it was signed on the 3rd, then it's 2 days. It can't be negative 2 days. All right? So the reason I am emphasizing it again is because I have seen it so much before, and students lose points for nothing. And don't get your formulas drive you, let your thinking drive you. And then you just have to, all you have to do is compare it to the standards that you already have. And was it on time or not? And then you add up all of those that were on time. Let's say you had 15 on time. It's 15 out of 20. Or you had 18 on time, 18 out of 20. And then, of course, you turn it into a percentage. So you would end up, let's say 18 out of 20 is 0.9, and that's 90% times 100, right? Okay, then let's close the recording, and hopefully everybody will do well and take advantage of the resources I've shared. And then next week, our session will be in the evening, and we will do a remediation presentation for the milestone test you're taking this week. So that will also serve as a review for the final exam. And if you have any questions, of course, about the memo at that point, we can address it. Okay? Anything else? And don't be scared about the test, Mariana, or anybody else. You know, it's only 70 points, and I'm sure you will get some of them right. You should be getting at least half of them right. It's actually not just this course. It goes back to record completion. It goes back to data management. You know, there's a lot of things together. That's why it's called a milestone test. It's similar to the one you took in HIT 170, that you kind of tested the knowledge you had up to that point. So this tests you the knowledge up to this point. And the reason we do that is just to see whether you're still remembering things from the past and the current. Okay, there's a lot of questions from this course. And the idea is when you're graduated, when you have graduated and sit for the RHIT exam, are you going to remember much? You know, just to try to remind you to review, really. That's what we're hoping for with these milestone tests. And the fact that you can get up to 30 points plus, that helps to hopefully it will alleviate some of the stress, and you just focus on doing your best. Okay, so I don't see any new questions. I'm going to end the recording and hope everybody has a great day. And if you have anything else that you haven't thought of until now, feel free to email me or post a question in the discussion area. We'll continue the discussions, of course, so I'll certainly try to address things there. Bye. Have a nice day.